We're talking about a procedure here that normally takes at least 2 visits to the doctor in order to have it completed. Well, we can get it all done in 1 day, get you back to work. Doctor, good to see you once again.
Thanks,
you've got Remo over here as well that's going to demonstrate this. I blew producer Nicole's joke earlier on, though. This procedure will have you back on your teeth in about an hour.
There you go.
Rather than back on your feet, which is the way so I'm sorry, I spoiled the joke. Spent a lot of time writing those things. We're talking about having crowns put on. Normally crown prep and then messy impressions and all that, then you have to come back a couple weeks later to have it fitted.
Right. I mean, now with technology, our whole thing in our office is we want to make it as comfortable as possible for the patients. We want to make it as convenient as possible, and obviously people are busy, so we want to make it as quick as possible.
Okay, so no more of the trays here?
No, normally when we would have to do a crown before, you'd have to take this big mess, fit it in your mouth. Not so comfortable.
And you sit there for 5 minutes or whatever it is while that thing sets up, and then then they have to redo it.
That's right.
Because it doesn't always come out right.
Let me show you this. Thank you. So now the way we take an impression is with this wand, and it's just a really high-tech camera that goes in, takes the impression of your tooth just by taking the digital photographs.
So you take several photos all around the tooth, and then it completely does all the math and does the imaging itself?
Right. It's fantastic because the way that it works, it captures a CAD/CAM image of the teeth in all 3 dimensions, and then we're able to reproduce what your natural tooth looks like with the computer.
Remo, about how long does it take then to reproduce the tooth?
It takes actually about 7 to 8 minutes to mill.
Really?
So, as far as the patient experience, it's a pretty fast procedure versus waiting the 2 weeks.
Wow. Do we want to actually demonstrate it? Are we able to do that since we've got Remo and the equipment here?
Let me just show you.
Show me what a blank looks like first off. This is what you start with?
This is the little block. And I think of this as like when Michelangelo was a sculptor, he said, I just see the person inside the block. And for us, the computer sees your tooth inside this block. So I'd love for you guys to see this. It's pretty amazing.
Let's push it and get close. There we are. We've got a good view of it.
Hit this, Remo, if you would. Go ahead and turn it on. And you'll see the machine begin to mill the block.
So this is, again, it's all done in 1 visit. And it's got to be a lot easier on folks.
It is. Well, imagine you only have to get numb once. You only have to come in once. There's no impression. There's no, worrying about your temporary. Is it going to? Can I eat something? Is it going to come off? Is it going to break?
Well, that's a good point. That 2 weeks or so waiting on that the permanent tooth. With that temporary in there, you're supposed to chew on the other side. They come off. They break.
Right.
They're not meant to be anything other than what they are, which is temporary. Okay, so this thing is just it's calculating and it's measuring, so we can keep talking while it's getting ready to do that.
So this is an amazing thing. A lot of people love to come and watch their own tooth being made, or they can we have a relaxation room. They can go have a cup of coffee, sit and relax while we're making their tooth for them, and then they just come back in. And this is, once it starts milling, the beautiful tooth comes right out. Okay,
so that, I just had another crown put in, and that looks identical to what I had put in my mouth, but you can do it all in 1 day.
Right, so this is the original teeth in a day.
Wow, that is something. I think we've got some before and after pictures as well. This is what you can do these days, and it's just absolutely mind-boggling. You can give people the perfect smile in a day.
There we go, so it's about to start here. And the best thing, Mark, is that, like I said, whether you only have to miss work 1 day, you don't have to get a babysitter for a day, you only want to get numb 1 day. It's just a great technology. Here we go. Now's the
There we go. It's done calculating, and that's the hard part. That's all done. And then look at these 2 milling arms go to work here.
So this just recreates your tooth based on what the computer predicts, and the camera measures for your tooth. So
let's talk about the strength of a crown and the material that you use, because some people say, oh, well, maybe a crown isn't as good as my original tooth. Not true.
Right. With this technology, there's several choices we have, but the main one we use is called the E-Max. It doesn't matter what it's called, but it is as strong or stronger than pretty much your natural tooth. And then these crowns, once it's made, are actually bonded onto your tooth so that the attachment of the crown is as strong as your natural tooth together.
So it's not coming off.
It's not coming off.
Unless you, the doctor, decide that it needs to.
Okay. Right. I mean, anything that can break your natural tooth could still break that, but otherwise otherwise it's on there forever.
Well, doctor, that whole process, like Remo says, takes, what, 10, 15 minutes at the most. You make so many offers for folks, and then you stack these offers one on top of another. We talked about this last time. You'll do the complimentary exam, you'll do the complimentary x-rays, and then if they book a procedure, you'll do the complimentary sedation if they want it, give them $250 off, and by the time we're all said and done here, you give about a $750 value here, absolutely free, if folks will just come in. So folks, the first thing to do is to come into Dr. Gray's office, have that free consultation, get those x-rays, have him take a look at this, and you decide between the two of you what needs to be done, and if you'd like to sit down and do it that day, you can probably do it. It's pretty amazing.
It's nice to come in with a broken tooth and leave with a perfectly good tooth.
Fantastic. Remo, thank you for coming in and setting everything up. Dr. Gray, thanks you.
Mark.
And again, about a $750 value, and just free offerings from Dr. Gray, but it all starts with that consultation, so make the call. For more information, you go to san diego6.com, you click on San Diego Living.